that have comorbidities are more vulnerable than others. But we also know that loneliness is a powerful disease. It can be deadly, and we have to do everything we can to guard against that as well. Each of these facilities has the option at this point in this pandemic to provide some safe ways for visitation, but hopefully these resources can help them get what they need to make it safe and possible if the facilities have not already been able to do so. If you're an operator looking for more information, you can get it from the Mississippi Development Authority at mississippi.org. Thank you to everyone who has worked so very hard to make this program possible. With that, I'm going to turn it over to Dr. Dobbs, who's going to give us an update on our numbers. Dr. Dobbs?
Thank you, Governor. So today, we're reporting 781 new cases and sadly 33 additional deaths. In long-term care facilities, we had 4 additional deaths with 158 active ongoing outbreaks. If we look at our total case burden for the state thus far, 84,365, with total COVID-related deaths of 2,526. And just for a fun exercise, I pulled out a couple of excerpts from death certificates so you could understand a little bit how we determine if it's a COVID-related death. I mean, there's been a lot of crazy theories out there about how this works. And so I'm going to read a couple of them to you, and you can figure out if you think it's a COVID-related death or not. Acute respiratory failure, secondary to COVID-19 and pneumonia. That's a COVID death. COVID caused respiratory failure and pneumonia. Acute respiratory failure from COVID-19. It's a COVID-related death, obviously. Pneumonia from COVID-19. That's a death from coronavirus, no doubt. But it has 2 entries on the death certificate, right? Heart disease with COVID-19 and myocardial infarction was not counted as a COVID death. Cardiopulmonary disease, heart disease, diabetes with contributing factor COVID, not counted as a COVID-related death. Cardiopulmonary arrest, heart failure, COVID-19, and hypertension, not counted as a COVID-related death. We take it very seriously and look into this very closely to make sure that it was COVID that caused the organ dysfunction, especially respiratory dysfunction. Just because you have coronavirus, even if it is part of the disease process, and perhaps we're over-conservative, but the people in Mississippi who have died from COVID that we're reporting definitely died from coronavirus. So please, let's put that silliness to rest. Other stuff to talk about today. We're very excited to be offering N95 masks to school nurses. They will be available at the drive-through testing locations on the same schedule as the free testing for teachers. That's starting immediately. So we've released that to the Department of Education and through other channels. So very happy for us to supply that for school nurses only, so that when they're taking care of ill children, or if they're doing nebulizing procedures like meter dose inhalers or breathing treatments, that they can have that extra measure of safety. Other things worth talking about today with schools. This past week we had a total number of new teachers with coronavirus, 138, new students, 280, 21 new outbreaks. We have a total number of teachers under quarantine of 532, with 3,730 students on quarantine. Certainly we're going to continue to work closely with colleges. Dr. Byers and I will be visiting with Jackson State University today and University of Southern Miss tomorrow. We're sad to report the death of a healthy child between the ages of 1 and 5 years old today. This child died of coronavirus and the MISI, the multi-system inflammatory syndrome, over the past couple of weeks. Very sad, and a powerful reminder that even though most people get over it just fine, even young, healthy people can die from it. And everything that we do to prevent transmission in the community is an act of love that prevents transmission to others and can lead to serious outcomes. Going into Labor Day, would like to reiterate the governor's plea. Please, let's not repeat the errors of Memorial Day and the 4th of July. We had massive increases in cases and deaths because we got carried away. Please, let's have a relaxing Labor Day weekend. Do stuff mostly outdoors, and then keep it small groups, preferably within the nuclear family. This is not the time to be having big family gatherings or big social gatherings. So please, please, please follow these warnings. And then the last thing is we are reporting one new West Nile virus case in Montgomery County. We still have other things going on. We've only had 3 reported West Nile cases this year, which is pretty phenomenal. But it is important to make sure that when we're outdoors, we remember to wear mosquito repellent and be careful with long sleeves if you can on those early morning and afternoon, early evening hours. And Governor, that's all I have. Thank you.
Thank you, Dr. Dobbs. I meant to mention this when I started. I do want to say it to those that are watching today. I did, we spent a lot of time in the last 6 or 8 months working on coronavirus and the issues that surround that. And some days I felt like we spent literally 24 straight hours doing it. I do want to just mention that I did have the opportunity a little after noon today to spend a little time on the tarmac over at Jackson International Airport, in which we had members of the 114th Military Police Company, the War Eagles, that have been in Kuwait and in the Middle East for the last 9 months, return back to Mississippi. We want to thank them for their service, thank them for what they've done for the United States of America, and let them know how proud they have made their fellow Mississippians by serving. They did a fantastic job, and it's sometimes good in these challenging times to see the big smile on people's faces. And for those men and women, I could even see their smiles through the mask that they were wearing on their airplane. So welcome back to the 114th Military Police Company. Thank you for your service to America. And with that, I'm going to turn it over to Mac, himself a former military man, and let him talk through from an emergency management perspective.
Roger that. Thank you, Governor. I want to report out on Hurricane Laura. We had our SAR search and rescue team that just returned from the ground zero, really. They accomplished some great things, sir, and just want to let you know that they were operating out of Cameron, Grand Chenier, more than 300 structures. They did assessment on them while they were there, numerous food and water and medical responses. That team had to go into locations that were impassable by other means, so they got there by boat and any other way that they could. They also provided intel to the state of Louisiana about where ground zero was, because they were one of the teams that went in there and found out where the initial impact came in and did that. They conducted air recons with Louisiana National Guard teams. They established landing zones all over the area for the National Guard teams as well. And they provided interoperability to other teams that were operating within Cameron Parish. So that team did an outstanding job. Very proud of that search and rescue team. And they come from all over the state of Mississippi, and they combine into one unified team and effort that goes into when things are bad, and they make it the best that they can. So that was a great deployment for that team. Our area assets with the Mississippi National Guard still are on standby. Possibility of them needing to rotate in and out with other air units that are there, but we stand by ready for the call and ready to provide those services. So that team did a great job. Also, in closing out, we had about 4 counties that reported damages: Adams, Warren, Adams County, Warren, Sunflower, and Wayne. We had approximately about 6 public roads that had major damage on it, and about 13 homes had anywhere from medium to light damage. But we continue to get those reports in from the county. So Mississippi stood well on that threat. I'm also to report in on the tropics today. I am very pleased to say that Tropical Storm Nana, that happens to be a lot of grandmothers' nicknames, it's headed toward Mexico. And we'll track through Central America at this time, and we don't feel like we're going to get any effects from that. That would be hard to explain to some of the grandchildren, I'm sure. We have Tropical Storm Omar has taken a right, and it is going out into the Atlantic. But we are watching 2 other storms coming off the west coast of Africa and between the Windward Islands and West Africa, about a 30% chance over the next 5 days. And we have another tropical wave over this, about 60% chance of forming coming off the coast as well. It is that season. We've talked about it many times here, and we want to echo it here. But we're watching that for the state of Mississippi. To follow up on the the municipality and county emergency relief program, we continue to process applications. But if you look at the numbers that are 83 82 counties and the Mississippi Band of Choctaw Indians, and approximately 362 municipalities in the state. I have 54 municipalities approved, 37 counties, and 6 others, whether they be state or nonprofits. So we have put out the call through the Municipal League as well as to the Association of Supervisors. Those applicants that are coming in, we're able to get those funds actually programmed and allocated. We're up to almost $3 million that we've got slided and ready to go, and it's a very easy process, but we still need more applications from those counties and from the municipalities. We put that out in our weekly call yesterday to the counties, and we started getting phone calls in about 15 minutes afterwards. So we continue to ring that bell that the opportunity is there to provide funding for those municipalities, for their emergency workers and others. And we continue to make good effort there, but we certainly would like to see more this early in the game, but some people wait till the fourth quarter, and we'll get that done, and we're going to be processing those throughout the end of this month. So we have time, but I'm telling those municipalities and counties, give me more time on the front side, and I can get the money programmed and get it going. FEMA is approving all those things that we're doing so far. On the very last thing to report out on, you see Dr. Dobbs and my boss here, Greg Michelle, the executive director of MEMA, here every time with the governor. So it's always health and always emergency management. Well, there's 34 areas of concentration that FEMA put out yesterday to city emergency management that have grants, that have monies, that have funding and have programs. And that's anything from agriculture, arts and culture, science, health, homelessness, mental and behavior health, migrant workers, you name it. There are 34 concentrations. That's going to be on our website by the end of the day today, and it will list every federal agency that has funding outside of what we normally operate in emergency management, which is the Stafford Act. So that when you look at protective measures, that's what I'm under right now. Category B, protective measures. That's the way we're moving and navigating through this actual disaster. But there's so many other resources that FEMA coordinates and MEMA coordinates through those state levels getting that done. And for an example, at the very last is Health and Human Services has just provided us with notice as of yesterday, 1.8 million community masks are on the way for schools. And that's going to be about 900,000 for adult size and 900,000 for youth. So we just don't go through FEMA for everything. We actually look at those other federal agencies that are out there that provide things outside just the emergency protective measures that we're actually working under. So just a big reminder there, and thanks, Dr. Dobbs. Having great news today. Keep up the great work, sir. And Governor, that's all I have.
Thank you, Mac. And I just want to say a couple of things, and then we'll open the floor to questions. Number one, as Mississippians, we know what it's like to suffer from major hurricanes. Let's keep our friends and neighbors in Lake Charles, Louisiana in our prayers. I know I've spoken to so many of my fellow Mississippians that have made runs over there, taken supplies, served food, cooked food. Stay safe while you're over there. Wear a mask. Be smart. Stay socially distanced, but we're going to step up and help our friends in need. Another thing I'll mention, particularly with the announcement that Mac just made with HHS sending us 1.8 million masks for our kids and adults in our K through 12 schools. Regardless of your political views and political affiliation, I've worked through Democrat administrations as well as other Republican administrations, and I've got to give this administration significant credit. They have worked exceptionally hard to make sure that the flow of information continues. It's not always this easy for the administration to be proactive in their information distribution. And so, Mac, thank you for mentioning that. Please be willing to go to the websites. I mentioned www.mississippi.org for the Mississippi Development Authority program that we put in place for the healthcare providers for the PPE and testing reimbursement program. And also, don't be afraid to go to the website that Mac mentioned, that Mississippi Emergency Management Agency's website, to get opportunities for other grant programs that by and large are funded through the CARES Act. Not entirely, but by and large. The federal government spent trillions of dollars already, and we certainly have the opportunity to benefit from that as well. So with that, I'll open the floor to questions. Emily?
Unrelated to the pandemic, the State Flag Commission today recommended a flag design that has a magnolia on the center of it. I just wanted to ask your opinion about that design.
Well, I've seen the flag, and I want to first say to those 9 individuals that served on the Flag Commission that we appreciate their service. I think in my conversations with them, they probably have heard from a lot of their fellow Mississippians and gotten opinions from a lot of their fellow Mississippians and have a little bit of an idea of what serving in public office is like in 2020. So I do want to say that I appreciate their service to our state for doing that. We're going to look at the flag and as a state come together and make a decision as to whether or not we want that to be our flag in the years to come. And so obviously it's got some traits that are very positive. I certainly appreciate the fact that the magnolia is on it. We think that it's very important that it has much like our state seal, which I fought for in the Mississippi legislature during my time as lieutenant governor. It's got the words "In God We Trust," and so I think they did a good job. It's I think a well done flag, and I think the people of Mississippi have a great opportunity if they choose to do so to implement this flag.
Thank you, Governor. I guess this is a two-part question. First off, do you think that the shutdown, through this pandemic has hurt, many businesses to the point where they may not be able to recover? And as the debate for more stimulus packages continue, in Washington or right here in Jackson, what can you tell those business owners with what is coming and how the government will still keep trying to help them, because we're not out of the woods?
Right. Well, we are not out of the woods. We know that. If we were out of the woods, we may not be sitting here right now. And we went through a spike in July and August, which led us to make some very challenging decisions to protect the public health. But the good news is that we were able to see significant reductions in overall transmission rates in Mississippi in July and August without a total economic shutdown, without closing businesses. Now, we've had to put restrictions on a few, none of which am I happy about. But yeah, I think you're exactly right. I think we're going to look back on 2020. There are going to be a lot of small businesses that don't make it, and that's horrible, and I absolutely hate it. And that's the reason that we worked with the Congress initially on the CARES Act funding, and then ultimately with the legislature to get our Back to Business program up and operational and funded, and try to get money in people's pockets as quickly as possible. But I don't think there's any doubt that there are going to be businesses that some of whom benefited from the PPP program out of the federal government, some of which participated and benefited from the Back to Business program of our administration, and even some of those are not going to make it. And so my heart aches for them, but I am proud of the fact that when you compare Mississippi and what we've been able to do in our economic recovery and compare it to most every other state around the nation, we are seeing a significant comeback economically, and that's something that is a testament to the resiliency of the people of our state. There's no doubt that there are going to be some small businesses that don't make it. Every single year there are small businesses that don't make it. But this year, probably more than any of my lifetime, a higher percentage of small business owners were facing challenges that they never faced before. And some of those, sadly, were because of government action. And so I'm hopeful that as we move into the fall, as the numbers continue to come down, if we'll just get through these next few weeks and continue to drive transmission lower and lower and lower, we'll continue to be able to get back to more and more normal environment. CJ?
Governor, this is for Dr. Dobbs, and it's a two-parter or follow-up, however you want to treat it, Dr. Dobbs. But I want to ask you about private schools and reporting these numbers. We have evidence that shows that one private school in Tunica County reported 12 cases to parents on August 18th. It appears those numbers were included in last week's update. They are not included in this week's under cumulative. In fact, it says there are no cases in Tunica County. At first, when we saw that, it looked like there might have been a reporting issue. Can you kind of clarify that for us as to why those numbers would have shifted like that?
Yeah, that's a good question. A lot of this is just process stuff we're kind of working out. So it is a requirement that we get the numbers on every school. Many schools send them directly to us. Many of them wanted to send it through the MAIS and as their broker of information. And so we don't have that updated information from MAIS yet, but we should have it shortly. We did get it last week. And we, value that partnership and expect for that. This is all sort of an evolving process of kind of working out the kinks. And so it absolutely will be there.
So it's not a breakdown in communication, and as far
Well,
as.
it kind of is. I mean, just kind
Well,
of
yeah,
like,
but it's not a failure report on their part, I guess.
Yes, sir. Yes, sir. Yeah. Not a failure.
So my follow-up is, have you seen, there's been some concern from parents that, and we actually asked for clarity last week from the health department on whether that health order that you issued that required reporting applied to private schools.
Oh, yes.
Because there was concern that parents were saying, well,